The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everybody. Thank you for joining us today. We hope that you and your family are staying well during this challenging time, and we're so glad that you could join us for this webinar. So we're going to go ahead and get started. I'm Jacqui Knudsen. I'm the Outreach and Education Manager for the Whole Child Model Project for Family Voices of California. So let's go ahead and talk, just in case anybody has any technical difficulties, we want to make sure that you know what to do. So of course, we hope there are no technical difficulties, but just in case, you should be able to see the 800 number listed here for any challenges. All of you start out as muted from our end, and then we can unmute you for any questions. If you do have a question, please type it in the questions pane. We'll do our best to answer all the questions during the presentation, and if not, we'll definitely follow up with you after the presentation, as well as if there's anything that I'm not able to answer, I will also follow up with you. Today's presentation is being recorded, and we will post it on the Family Voices website along with the PowerPoint slides. Also, I wanted to point out that on the Family Voices website, we do have webinars that are archived, and you may want to check some of those out as well. So a little bit about today's webinar. We're hosting this webinar as part of our contract with Department of Healthcare Services to provide information and education to family members, service providers, and Family Resource Center staff who support families in the Whole Child Model counties. These are the areas that we're going to focus on and provide additional details to explain what changes have happened. We're planning to take no longer than an hour of your time today, and we also want you to know that we're here to assist you anytime in the future, even after today's webinar. So let's talk a little bit about Family Voices of California, who we are, what we do. We work with a statewide collaborative of parent-run centers. Most of us know most of those to be called Family Resource Centers. We're a state affiliate of National Family Voices. We're known as California's Family-to-Family Health Information Center. We provide statewide support to families of children and youth with special health care needs. We provide skill building and information to help families become better advocates for systems change and to build partnerships. We give families an opportunity to develop and amplify that voice. So what exactly do we mean when we say a child with special health care needs? We define that as one or more chronic physical, developmental, behavioral, or emotional conditions that require health and support services beyond those required by most children. So we know that that can mean, that term can mean different things to different people. So we just want to be clear about that. And also note that this includes approximately 1.5 million children in California and about 10% of the nation's children total. This is what we look like at Family Voices. This is our organizational structure. We have offices. We have an office located at Support for Families of Children with Disabilities in San Francisco. And Family Voices, as you'll see on the right-hand side, the upper box, Family Voices of California has an executive council with member agencies across the state. And that's so that we can work together and get that broad perspective of what families need. Pip Marks is our project director for Family Voices, and she's also assisting me with this webinar today. And you can see that Elaine Lynn is the project leadership manager, and I believe we may have some project leadership graduates joining us today. Allie Barclay is our family engagement manager, and you already know that I'm the outreach and education manager for the Whole Child Model project. Okay, so what exactly is the Whole Child Model? A simple explanation is that the Whole Child Model transferred coordination of care and case management from CCS, California Children's Services, into Medi-Cal managed care plans in 21 of 58 counties in the state. So exactly, let's talk about how this happened and what caused the change. There were many stakeholders involved with providing input before the bill was authorized, Senate Bill 586, and Family Voices was one of those stakeholder agencies. And this is going back to, I believe, as far back as 2015. And when Senate Bill 586 was passed, and it was passed and signed into law in 2016. That's when the Whole Child Model began. And there are many different protections and goals with the program, which I'll explain in greater detail a little bit later in the presentation. I also wanted to point out that there's a handout section in this webinar, as part of this webinar, and you may, after today, want to take a look at the entire bill, and it makes for some interesting bedtime reading. There are quite a few details in that Senate bill language. So it was authorized by Senator Hernandez and signed into law by Governor Jerry Brown back in September 2016. So what exactly were the goals of the CCS redesign? The Whole Child Model intended to eliminate a bifurcated system where families were receiving services from two separate systems that didn't always coordinate effectively. And so the focus to reorganize California Children's Services Program in the 21 counties began, as I said, several years before the legislation was passed. And the Department of Healthcare Services oversees both CCS, California Children's Services, and Medi-Cal. And Department of Healthcare Services came up with these 6 goals for what we call the CCS redesign, which is Whole Child Model. Any questions so far?
I don't see any, Jacqui, that have come in so far.
Okay, great. Thank you, Pip. So implementation of the Whole Child Model. It was done in 3 different phases. And the first phase started in July of 2018. As you can see there, you can see which counties and which health plans are a part of these different phases. So the first one was in July of 2018. And then the most recent and the final phase was in Orange County starting in July of 2019. And the intent was to learn and build upon lessons with each new phase coming online. So Medi-Cal and county organized health systems. So how do Medi-Cal county organized health systems and CCS work together? These managed care health plans authorize and pay for the care that is covered by Medi-Cal in those counties that we saw before. So for instance, if you have Medi-Cal and you reside in Sonoma County, I'll go back here, obviously you're a member of Partnership Health Plan. And you can see the others that are listed there as well. So under the Whole Child Model, these managed care health plans are responsible for most of the services that may have been received previously from the county CCS office. So let's talk a little bit about CCS, California Children's Services. So as you can see, it's been around for quite a while, 93 years to be exact, a long time. And I don't think any of us were around when that started. CCS is one of the nation's oldest public health programs, and it was originally created to address the growing polio epidemic, which is a virus that spreads from person to person and can affect a person's spinal cord, to give you a short explanation. You can see there what the requirements are for CCS, and a lot of those, especially that household income, a lot of people talk about the fact that that's extremely outdated and really should be looked at. So you can see those requirements, and the addition there is household income of $40,000 a year or less, or 20% or more of somebody's adjusted gross income is going to pay for those related services. So what coverage? You can see that these are the coverages provided by CCS. And also, I am going to add another handout so that you have CCS qualifying conditions. There are quite a few. So I want you to have that information, and I'll add that to the handouts as well. So this has been something that we've really had to share with folks and remind them that CCS is not going away in whole child model counties. There's been a lot of confusion about this, and that's part of our effort to be providing outreach and education, is to make sure that families know CCS is not going away in whole child model counties. So what are some of the changes? You know, what's different? So what's different is the way services are authorized, paid for, and managed. That's what the changes in the whole child model program brought about. So you can see here that the county CCS programs will still determine medical and other eligibility and process referrals and applications. They will also coordinate the medical therapy program. And the health plans will now authorize services and treatments related to the CCS eligible condition, as well as primary care services, and they will also provide the case management. So let's talk about the case management. Before the whole child model, the CCS nurse case manager was very involved in overseeing many aspects of care and coordination. And we've heard from many families this has been a big challenge, to lose that really close relationship that they've had, where somebody knows everything about their child's needs and their family. So that's been a big adjustment for families, we realize that. And now the health plan, or the county organized health system, oversaw the primary care before whole child model. So that was before whole child model. CCS case manager oversaw and authorized specialty care, health plan oversaw primary care, and CCS services were paid for by state Medi-Cal, and primary care services paid for by the plan. That is before whole child model. So after whole child model, now the county organized health system oversees and authorizes both types of care, primary and specialty. One of the big benefits of whole child model is to be case management. We realize that some of the bugs are still being worked out in this area, and if a family doesn't know who their case manager is, we encourage them to contact their health plan right away, hopefully before they really need any services, to find out who that is, so that they have one point of contact. That is so important. Again, we've heard from some families that this information can be difficult to find out, and we really want to make sure that they know that before anything urgent happens. Many of the health plans are using member service departments to triage the calls. So we know that it can be a challenge for families to get to the right department. Hopefully, if they call and they're talking to a customer service person or member services person and they say whole child model, then there will be people specifically assigned to talk to those families and assist them with the care that they need. This is also an area, if you or you're working with any families that need assistance in this area, I can gladly help and get through those, navigating some of those systems. Okay, well, we're going to move on. So any questions about case management?
Jacqui, there's not a question about case management, but a question about, do you know if the Department of Healthcare Services is planning to expand the whole child model into more counties than just the 21 that are currently?
Thank you. Great question. So no, there is no plan to expand.
Okay, thank you.
Yes. Okay, let's talk about maintenance and transportation. What exactly is that? We've heard from many families that they didn't even know that this was a benefit for their family and their child. It existed when it was when the families were receiving services through CCS, and this is something that was usually handled directly by the nurse case manager. So the benefits that are included are lodging, food, transportation assistance. So before the whole child model, the county CCS program approved these supports, and this was again handled by CCS, and again typically by the nurse case manager. So moving along now, after whole child model, again, it's important for families to contact their plan as soon as they know they're going to need this type of support. Obviously, it's a little more time consuming now for these requests to be processed, and the plans are often dependent upon outside vendors to provide these services. So it's really important that ample time be allowed to coordinate. It's really key here. And again, this is where it comes in handy to know who the case manager is and be able to pick up the phone and call that one person that you need help from. Just to share a little story, in the recent past, I had assisted a family from a very remote county in Northern California. They had to drive 4 hours to San Francisco to take their child to an appointment, and they were going to need to stay the night. So we contacted their health plan ahead of time, got assistance with the hotel reservations as well as reimbursement for mileage. So it worked out just fine, but again, it took quite a few of us coordinating that effort. So we want to do whatever we can to support families to get this support as smoothly as possible. Families already have enough on their plates, and we realize that. Okay, so continuity of care. We know that continuity of care is very important when relationships are already established with specialists who know the child very well. And continuity of care is available up to 12 months after transitioning to the whole child model. Sometimes families can continue to utilize specialists as needed beyond that 12-month period. So talking to the child's case manager at the plan can often result in the child and family continuing to see the specialist. So you're probably seeing a theme here. It's super important for families to establish a relationship with their child's case manager at the health plan. Of course, families can always appeal if they are not satisfied with a decision related to continuity of care. And you can see, let's talk a little bit here about the continuity of care requests and the requirements. So these are some of the requirements, basically, that the provider has to have seen the child at least once for a non-emergency visit within 12 months prior to the transition. Also, the provider needs to accept the health plan's rate for payment, and the provider does need to be CCS paneled. And it is noted here that CCS members do have the right to extend a continuity of care request past the original 12 months. If that request is denied, they do have the right to appeal directly to Department of Healthcare Services. So again, this was very important with this transition, that families have coordinated care, no gap in services, and the same quality of care. Grievance and appeal process. If you or any family have an issue and want to file a grievance, we recommend referring back to those redesign goals and explain how any of those are not being met. That was key in this whole redesign, or to meet those 6 goals. There are also legal protections in SB 586, and it's important to use that language as well. And again, we realize that this can be challenging. Families already have enough on their plate. It's not always comfortable to use this process. And so we at Family Voices are here to help. Family advisory committees. We're down to the last few slides and a little last bit of information, but very important. And a great way to provide feedback and information to the health plan is to participate on the Family Advisory Committee. Each plan has their own committee and schedules do vary. It also provides an opportunity to meet other family members who share the same concerns and work together to make a positive difference. I know in the area of San Mateo, there is one of the parents who is a co-chair for the health plan of San Mateo also has a support group that she runs. And so it's a great way for families to be connected with one another and support each other and find out what resources there are to support their family. Also, each of those 5 health plans that are part of Whole Child Model have a representative who attend quarterly meetings in Sacramento to represent parents from their local plan and provide input at the state level. So our voices do matter as parents.
Jacqui, there's a question about the family advisory committees. Do you know, are the family members compensated for their time on the committees, or do they offer some kind of stipend or reimbursement for time, travel?
Great question. So yes, I believe one of, or a couple of the family advisory committees I know do provide their one FAC provides their families a check that they send them for attending the meeting. And then the other FAC that I know of provides a gift card. And I believe those are right around $50.
Okay.
So yes, there is compensation. And then for those individuals who are part of the quarterly meetings in Sacramento, those health plans will also reimburse those families for their travel expenses to get to Sacramento.
Okay, very good. Thank you.
Thank you. This is my contact information, and I hope that you will please reach out to me if I can be of any help at all. You and the families that you serve do not need to navigate these systems alone. We know that they're complex and time-consuming, and families already have a lot on their plates, as I said earlier. So we are here to help. I am here to help in any way that I can. I also want to point out to you that we have obviously we have a website at Family Voices. I encourage you to take a look at our website. And we also have a monthly newsletter called News Digest. If you go to our website, there will be a little pop-up and you can input your name and your email address, and then you'll be on that list. And that's a great way to find out about future webinars and information that's really important to know as well. We also have a Facebook page And would love it if you would like our Facebook page, Family Voices of California, that is.
Jacqui, Jacqui, there's one more question, and this is great information. Thank you. But, you know, since the Health Summit was postponed, not until August 4th through the 6th, October 4th through the 6th, will you still be doing a breakout session on the whole child model?
Thank you. Great question. Yes, we are planning to do that in October.
Okay.
Yes. And that session will be a little more detailed, and we also hope to have representatives from the different health plans who can answer specific questions about how they are providing services and how families can navigate their health plans. Each of those 5 health plans functions a little bit differently, although all of them are responsible to provide information and data to the Department of Healthcare Services. But obviously the way each of those function and serve families does vary a bit. So we do hope to have plan representatives in Sacramento in October. So lastly, organize, don't agonize. We're here to help you any way that we can. And we really, really appreciate your valuable time today and hope that you've enjoyed the webinar. And we can certainly take questions if there are any. And again, we're here for you.
I'm going to unmute the lines so that attendees can ask a question if they have one before we sign off.
No, they had referred to feeding therapy in February, but she didn't get the therapy because the shelter in place happened. That's why she didn't get the therapy yet.
Oops, I think that attendee might have been on a different call or talking with somebody else. Okay, Jacqui, thank you so much for the presentation about whole child model. I hope that the attendees have had a chance to download the handouts if they would like them, but they'll also be up on the web page, I believe, right? Jacqui?
Okay, wonderful. Thank you all so much.
Okay, thank you. Bye-bye.